चितवे नित्य निरंजन नित्य नटेशा ईशा सर्वेश सर्वेशा शंभो शिव शंभो स्वयंभो दिमित दिमित दिमि दिमि किट किट तोम 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 तरि किट तोम मतांग मुनिवर वल्दित ईशा सर्वदिगंबर वे चितवे श नित्य निरंजन नित्य नटेशा ईशा सर्वेशा सर्वेशा शंभो शिव शंभो स्वयंभो शिव शंभो स्वयंभो शिव शंभो स्वयंभो.
Thank you so much, Janani. That was really wonderful. Thank you so much. Good afternoon, everyone. My name is Vikas Raj, and I have the privilege of serving as the chair of the South Asian Impact Foundation. It is so wonderful to be here with all of you today. And let me start by wishing you a happy National Voter Registration Day. If you are eligible and not registered, please see one of our staff so that we can get you registered. I don't need to tell this group. We need to vote, all of us, now more than ever. So please register if you haven't. At the South Asian Impact Foundation, our mission is to build political power and civic engagement in South Asian communities, to make sure our voices are not only heard, but are central to the future of our country. That's the heart of why we gather here each year. So on behalf of our board and our incredible staff, I am honored to welcome you to the 2025 Desis Persist Summit. Welcome. Let's do a quick show of hands. Who's here for for your very first summit? Wow. Wow. Welcome. Welcome. That's wonderful. I've been coming to this summit since the very first in 2017, and I can tell you, you are in for a treat. Over the next 2 days, we'll build community, we'll forge new connections, and we'll leave here with stronger networks than ever. We're grateful to the dozens of partner organizations that are here, whether leading a session, speaking, tabling at the expo, or joining us for our first ever South Asian Hill Day tomorrow. So please make time to meet them, learn more about their incredible work. This year also marks our first summit with an art exhibit, as you've seen outside, featuring work by 15 extraordinary South Asian artists, as well as the My Immigrant Roots exhibit, which is curated by Stop Oppie Hate. I really encourage you to spend some time with these pieces. They tell stories that words alone cannot capture, and they help us think deeply about our common challenges and common opportunities. We're also joined by more than 20 South Asian elected leaders from across the country, serving at every level of government. If you're serving in elected office, would you please stand so that we can recognize you? Anybody serving in elected office? These are the folks I really want to celebrate because they provide a voice from the county level to Capitol Hill, a few blocks from here, that is clearly so needed in this moment. Our theme this year could not be more urgent, more requiring of these voices. Desis persist, our stories and our strength. These are unsettling times. And over the next 2 days, we will not pretend otherwise. Our nation is more polarized than ever. Political violence has escalated. And many of you arrived here in DC and saw National Guard on the streets. For our community, this moment feels particularly heavy. Anti-immigrant rhetoric, hate incidents, deportations, and visa revocations at levels that can sometimes make it feel like we don't know exactly where to turn. But the truth is, we do. We turn to each other, the other people in this room. We are strongest when we face these challenges side by side, even if at times we don't agree. That's okay. That's who we are. Our 150-year history in this country shows that even in the hardest moments, when doors were closed to us, when the specter of anti-Asian bigotry reared its head, we have always refused to be defined by hate. Instead, we have found ways to build community, to lift one another up, and to keep going, turning struggle into strength. That's the spirit that will carry us through today and tomorrow and the coming months and years. That is what the summit is about, uniting in our stories and finding in them the power to persist. So, Daisies persist. And we are so thrilled that you are all here and a part of it. So that brings me to our opening plenary. Beyond the exam room, South Asian health leaders shaping trust. South Asians are clearly among the most represented groups in America's medical workforce, but the impact of our community's doctors, researchers, and health leaders extends far beyond clinics and hospitals. At a time of rampant health misinformation, South Asian medical professionals are emerging as some of the most trusted and effective messengers in the country, using their expertise to translate science, safeguard public health, and serve communities far beyond their own. To guide the conversation, please welcome our moderator, Vin Gupta. Vin, please join us on stage. You know Dr. Gupta. He's one of the nation's most recognizable medical experts, a practicing pulmonologist, NBC News and MSNBC medical analyst, and managing director of health innovation at Manat. He'll be joined by, and please just join me on stage as I go through your names here, Dr. Mona Amin, pediatrician, founder of Peds Doc Talk, and a leading health and parenting content creator. Welcome, Dr. Amin. Dr. Meena Seshamani, Secretary of Health for Maryland and former director of the Center of Medicare in the Biden-Harris administration. Dr. Arif Kamal, the inaugural Chief Patient Officer for the American Cancer Society. And Dr. Arvind Venkat, emergency physician and state representative in the Pennsylvania House. Welcome again, and thank you all for being here.
Thanks, Vikas. And thank you, everybody. This is quite the turnout. We have an incredible group, and this is, you'll see the bios. I'm going to ask everybody actually on the panel to go and introduce themselves briefly so we can get to the substance of this conversation. But this is a powerhouse panel, given the theme here, so thank you so much for being here. But if we can just go down, Mona, and then Meena, and so on, just a little bit about your background, and then we'll get started.
Thank you, and thank you so much for having me here, organizers. My first time, and I am excited to be back for more. I am Dr. Mona Amin, a board-certified pediatrician, an IBCLC, a lactation consultant, which is very rare. There's not a lot of South Asian lactation consultants. I also am an online content creator. So if any of you are not familiar with what that is, I create videos online. I have an Instagram, TikTok, Facebook, YouTube, podcasts with reaching over 2 million people across the world. So not only US, but a lot of my followers are in India as well, and Australia and the UK. And I share a lot of education about child health, development, parenting, but a lot on advocacy. So as you can imagine, being a pediatrician right now in this climate, a lot of education on healthcare advocacy, vaccine access, a lot of things about immigration, obviously. And so I'm doing a lot of that work and excited to share more about my journey with you all.
Thanks. I'll echo the thanks for being able to be here with all of you. I'm Meena Seshmani. I am an otolaryngologist, or an ear, nose, and throat surgeon, and a health economist. And I currently serve as the Secretary of Health for Maryland. Previously, I led the Medicare program, and I've also served in leadership positions in health systems and taken care of patients at the bedside. And as mentioned, this is definitely a very interesting time that we are in, and I think one in which, one that really calls for calm leadership and being able to bring people together as we chart a path forward for how we can improve health in our country.
Yeah, good afternoon. I'm Arif Kamal. I'm a medical oncologist and palliative care physician at Duke University and the Chief Patient Officer at the American Cancer Society. And I think, in the times that we live in, it's important to figure out what we agree on, regardless of our backgrounds or our political affiliations. And fortunately, I think ending cancer as we know it for everyone is something that we can all agree on. And in the health space, we oftentimes start with that space, which is we're here to reduce the scourge of cancer across the country. And there's been a lot of really great improvement that's happened over the last 30 years, but importantly, we don't want to lose that momentum. So a lot of what we do at ACS is to work with partners like up here on the stage and in government and nonprofit and other sectors to make sure that the things we agree on stay at the forefront of people's minds and that we're investing in what makes this country great, which in a lot of ways has been our investment in health technology and improvement in outcomes.
Afternoon, everyone. My name is Arvind Venkat. Thank you to Impact for the invitation, and truly an honor to be on this panel with all of my colleagues. I'm an emergency physician. I'm an academic emergency physician and professor of emergency medicine, and now I also serve as state representative from the 30th Legislative District in the North Hills suburbs of Pittsburgh. I'm the first Indian American to serve in the state house in Pennsylvania, and the first physician to serve in our legislature, House or Senate, since the mid-1960s. So I would echo the comments from colleagues on the panel. This is a very critical moment for the South Asian community and for the healthcare community, and look forward to the discussion today.
That's great. So I do want to say that we want to make this as engaging as possible. So please, if you have questions, we'll have mic runners. Just raise your hand. I'm going to do my best to call in as many questions as possible. And then to our leaders here, Sarah and team, let me know when we should be wrapping up here because okay, perfect. So Arvind, I'm gonna pose this to you and then maybe we can bring this back. So round robin. I'm sure we were talking about this earlier, there's young people across the spectrum, some represented in this room, across our diaspora, across the country, that wonder, they're interested in healthcare, they see the headlines, and they want to run for office. Or Meena, they want to become the next Secretary of Health. Arvind, they want to be a leader in a major entity like ACS. Or, Mona was quite humble. She has 1.2 million followers on Instagram, arguably one of the most influential pediatricians in the country. How, Arvind, starting with you, but then coming down, give us some actionable advice on if you're starting from nowhere or you don't know how to start, how do you get to where you're at? And then the same question for everybody.
Sure. So, honestly, it's a matter of grasping the opportunities when they came up. My involvement with advocacy really started by accident. I was president of the State Emergency Physicians Organization in Pennsylvania when COVID hit. Because ER docs, as we see on the show The Pit, great show, based on the hospital where I worked for 15 years, ER docs were thrust into the public limelight with the onset of COVID. And so I was very involved in my local community in providing advice of how to stay safe and move forward. And seeing the divisions that we have to this day related to healthcare and science, it motivated me to run for office. I decided to run at the state level because most of healthcare is regulated at the state level, and I felt that's where I could be of most use to the people in my community. In terms of where to start, all politics is local. I mean, when I expressed an interest in running for office, I was fortunate through the local Democratic committee to be connected with political professionals, just like all of us are healthcare professionals, who could guide me in how to run an effective campaign, how to deliver a message, how to raise money, where you want to avoid conflicts where you can. and to focus on what really mattered in terms of being successful. So my advice to folks who are interested in running for office is think about your background, look for those opportunities based on what your circumstance is, be able to articulate what your why is for running for office, and then be humble and recognize that whatever your expertise is, it's probably not in the political process. Organizations like Impact were extraordinarily supportive of me in my run for office in pointing me in the right direction to be successful. So accept that expertise and take advantage of that and seek that out.
Yeah, I think that's great. I've been an oncologist for a long time, and in making the transition to ACS, I think, there's a lot of components of what is humanistic, patient-centered care that really applies in a lot of different other parts of life. And I think this concept of relatability is really important, right? It's the root of the word relationship. And oftentimes, as we get busy or we get stressed, relationships can become very transactional. It can kind of become human nature that you have something I need and I have something you need, and that's how we're going to talk to each other. Right, and fundamentally, really important discourse requires relatability. As a physician, it's mandatory that you build a relationship on rapport that has everything to do with what do we have in common. That's the concept of relatability. And I think no matter what we're involved in, whatever the conversation is about, I think regardless of your background or your professional role, that finding relatability with another person, which means starting with yourself, finding what is it that makes you relatable to the person you're talking to. And sometimes that's the challenge, because you may be looking across from someone who may seem very different than you are. You have very different backgrounds, but there's something you have in common. At very least, being humans who are interested in the good of humanity is maybe where it starts. And so that's the advice I give to a lot of people I talk to. Say, find the thing you have in common with the other person, instead of, for example, trying to hone in on the thing that may be different. And from relatability then gets to trust. Trust then gets to conversation, and conversation can get to alignment of some sort, and I think that's important.
I think Mona and I are in the enviable positions of going after, other people. I would kind of, in some ways, summarize a little bit about what has been said about the importance of figuring out your why, helping that to drive the connections that you make with others, and that then leads to mentorship and opportunities presenting themselves in terms of, wherever you want to go. And I think importantly, Vin said where people are starting from scratch or starting from the ground, all of you have whatever it is that you need, because you have your why, because you have your experiences, be they professional experiences or personal experiences or both. And I think one of the things that has been very important for me, and that I think through my career I have discovered more and more the power that it has, is being able to bring not only the professional experiences of taking care of patients, where now I can give an example of somebody who has directly benefited from a policy that I implemented, but also family members. I'm a caregiver for my parents, for my children. And I think that, to your point of relatability, we all have those parts of us that I think it's really important, and this comes to the theme of this conference, right? Our stories, our strengths, and I think that leveraging your stories as part of your why on your journey will help unlock the opportunities and the connections and the mentorship that you need to be able to deliver impact to those around you.
You're right, it is hard to go last. I think one of the most beautiful things about this panel is that we all have found different aspects of the world to spread our strengths. And that's one of my biggest tips, is that we can want to do it all. We're Indian Americans. We think we can do it all because we were raised that way.
At least our parents think we can do it.
They're like, you're going to be a go-getter. But you have to also know your strengths and weaknesses. So I use mine as an example. I'm really good at talking to people, and I'm really good at writing. So I found that going online blogging, creating videos. I love doing skits and acting, all of that stuff. That was fun for me. And so that was my outlet. Whereas for another person, it might be advocacy, it might be running for a political office or being in charge of an organization. So it's about finding your strengths and weaknesses. And if you have a weakness, how can I do things to improve that? For me, it's coming to this conference, right? I may be better at advocacy. I could be better at, learning about politics. So that is the number one thing that I would say. Also, knowing what your interests are in terms of like who are you speaking to. I really speak to parents. Not all my followers are South Asian, but they know that I'm South Asian. They know that I'm very proud of my heritage. I share a little bit of my culture on my social media as well. But knowing who you're trying to reach and seeing how am I going to make that happen? Whether it's I want to represent my community as a politician, or am I going to go online and be a social media creator? And everything is going to be different. I think every one of us can say there's benefits and difficulties to everything that we do. And it's just all about knowing self enough to know what you want and what you're good at, and being okay saying, and a little bit humble in saying, I can't be good at everything, and that is okay, but how can I use my superpower to help the world? And so make sure you tap into that superpower.
Yeah, and I would just add, brilliant advice from 4 changemakers who are doing it. I feel, especially for those in the healthcare profession, Indian diaspora is overrepresented in a really good way at the highest levels in the healthcare profession. What I found, though, is that there is not a mentorship structure in place in academic medicine to support, in my opinion, all the lofty heights all of you have achieved. There's judgment. I'll say somebody is, I do a lot of media. That is not something that you get credited for within the 4 walls of a hospital or an academic center, even if you feel like you're doing it for the right reasons and you're trying to have impact. So just a word to the wise here, encourage everybody. I think that this gala is for fellowship and for networking, and the mentorships that you may lack in your communities or in your systems back home, let's try to develop them here if you feel like there's that gap. Meena, I want to come to you. You are Secretary of Health of one of the most innovative states when it comes to healthcare policy in the country. I am wondering, and as former head of Medicare prior, you are navigating, and this is probably an understatement, a very difficult federal environment, a very difficult health information ecosystem. How are you navigating the issue of trust, just to think about the umbrella theme here from your position?
Yeah, thank you for that question. I think actually my answer will build on what we've all been talking about in the advice that we give to others. I think a lot of building trust in this environment is coming back to our commonalities and finding what those are and finding ways to connect, which likely will not be in the ways that communication has traditionally happened. And for us, being able to work very closely with our community partners, bringing messages to our trusted messengers in the local community is so important, especially now in this time of distrust of institutions. And I think also being able to come back to what evidence shows, but to do it in a way that is relatable to people, that they can understand, where they then feel that they are in a 2-way communication and not being lectured at with 3- and 4-syllable words that they then have to go and Google. So I think those are all tenets that are very important. And I think from leading the Medicare program and now here, one of the only ways I think that you can be successful in tackling the complex issues that are in healthcare is by bringing everyone to the table. And I will continue to say that even in times where it doesn't seem that everyone is being brought to the table, because that's how you can actually get things done. I stood up Medicare drug price negotiation, which, as you may remember, highly controversial. There was litigation, there was press, or is this gonna fail? Is this gonna go well? I brought payers, pharmaceutical companies, patient groups, physicians, everyone in Let's talk about what matters to you. And guess what? There was commonality. Everybody agreed that we should have innovation that drives important cures and therapies, and that people need to be able to access those innovations, from a business model for pharmaceutical companies to, the healthcare improvements that people want to have. And how do you leverage that then to be that why that can get you through those difficult conversations? And not just accepting that there are difficult conversations, but seeking them out. Saying, I know that we're not going to agree on everything, but it's important that we all listen to each other and that we acknowledge each other and respect each other. And then people like me or people like Arvind who are in public service, we're in the enviable positions of having to make decisions where nobody gets exactly what they wanted. However, one of the biggest compliments that I got as I was transitioning out of the Medicare program was that one of our major stakeholder associations said to me, you and your team were always so responsive and professional. We didn't always agree with the decisions you made. In fact, many times they did not agree with the decisions that we made. But we always knew why you were making them. And so I think that's something, especially in this time of fiery rhetoric and us versus them and building up walls, that it's on all of us to help bring those walls down just by tapping into our common humanity and tapping into our common why and our own humility.
Yeah, I have to say, Mina, just to give her flowers here, we met for the first time at this gala last year. So networking here does sustain itself. But to drug pricing and what you did at Medicare, you can't do that by executive order, which is what's happening right now. You have to do the hard work of bringing people to the table. And by the way, the current administration has continued what the secretary here started back in her time at the Biden administration. So I just want to say that worked. That's just not, your words reflected deeds that are working. Mona, I want you to jump in here. You've talked a lot about relatability. You reach the masses on Instagram and your social channels. I'm sure there are trolls that disagree, especially at this moment when I think tomorrow we're revisiting potentially vaccine schedules or later this week for children. Talk us through how you navigate trolls, millions of followers on Instagram, and how do you not let that detract you from your mission?
You got to have some thick skin to be online, very thick skin. And that's something that I developed over the last 7 years doing this. And not taking it personal. I think one of the biggest things is they are not going to agree with your policy, but it's not something personal, even if it feels that way. I think one of the most important things is, like she said, I always go into, we have a common goal here. I think I'm going to use vaccines as an example. I vaccinate my kids, you may not, but I think we both agree that we want to keep our kids healthy. So that's the common goal. And then we go into the facts. Why? I think every human being in this world wants to be talked to as a peer. And so that relatability comment is very valid, that I think the reason I've been able to gain a platform is that people don't look at me as this uppity pediatrician who's speaking down to them. I'm speaking to them mom to mom, parent to parent, and it comes across in the content. And so they don't look at me as this uppity doctor, they look at me as this human being that cares about their kids, but that also knows a lot about my field. And so I think that's really important. And then the trolls, I have a team that helps me. We are very big on that block and delete button, just because you have to protect your peace in this world. So, and I believe in an energy vibe that if I'm going to have those people in my community, it only is going to bring me down. So block and delete and move forward.
Good for you. Good for you. Just another call here. Let's get some questions from the audience. Oh, please. Okay. I saw 2 hands up here. Here, I can mic run here. Oh, you got it. Okay.
Oh, I don't have a mic. I need to borrow one. Sorry. Hi, I'm Pradnya Haldipur. Much to my parents' chagrin, I am not a doctor. I did fundraise for academic medicine for a long time, though, and so deep respect for all of you and the ways in which you have gone from practitioner to advancing your knowledge and skills in other parts. My question is, for each of you, it's a huge system, a complex system, a multi-faceted, fast-moving system. If there was one thing, one small tweak that you all could wave a magic wand and feel is catalytic to move things in a positive direction, whatever that means for you? What would that be?
Sure, the easy one. So first of all, thank you for the question. I'm going to take it from a policy perspective, and Meena can probably speak about this as well, but I think one of the real challenges we're seeing in the healthcare system is how much consolidation we've allowed horizontally and vertically. In Pennsylvania, where I am, we're essentially down to 5 health systems. Where I am in Western Pennsylvania, we're down to 2. And they are insurer with hospital, with clinicians, with patient bases, and it makes it very difficult to take actions in innovation and on the behalf of patients because of that consolidation. So if I had one policy wish with a magic wand, it would be that we have much more rigorous enforcement of antitrust in the healthcare setting in order to allow far more competition across the board and have those forces work much more than they do now in healthcare.
I might, just so we can get to as many questions as possible, maybe Reef, if you want to weigh in, and then we'll take additionals.
Yeah, I think we're on a journey to understanding the role of health-related social needs on impact on health outcomes. And really, health-related social needs, screening and interventions are part of a healthcare ecosystem. And the more we understand that, the more the other 80% of things not improving when we take care of the 20% of biology is going to start to make real good sense to us. And then attached to that, I would say at ACS, we're big proponents of navigation. And this is both a policy issue and a payment issue and a workforce adequacy issue, is that healthcare might be one of the only places where we let people just kind of wander around on their own. And if that were to work, right, people would get appointments on time, they'd get to where they need to go. The reality is that navigation makes a difference for all people of all backgrounds. Whether you're a model minority, I'll tell you in the cancer statistics space that our communities here are less likely to get colorectal cancer screening, HPV vaccination, right, so lung cancer screening for sure. So everyone needs a little help sometime, and sometimes that's another human being being relatable, being compassionate to you, whose job it is to stand shoulder to shoulder with you and make sure you get to where you need to go. And that's navigation. And so we need to build that out so it's not a nice to have, it's an absolute must have in all parts of healthcare.
I don't mean to cut off the question, but we have a ton of questions here. Perfect.
Hi, my name is Shubhra Sinha, representing Desi Blue here. I have a 2-part question, but hopefully it'll be a quick answer. My parents got their green card last year, and they're both in their late 80s, and they moved to live with me here in Virginia. So the first part is a personal part, where my father is terribly scared. Every day he's like, is Medicare going away? Will they do anything to my Obamacare? Will I have to pay 5 times what I'm paying right now? So how do people like him find the truth underneath all the smoke, right? What really is going to happen with this administration and everything that older parents are looking for and are dependent on? The flip side of that for this community here is how do we take that and advocate for Democrats? Right? How do we take the policies and the noise around those policies and get people to vote to get the right policies in place and get away from all this hoopla that's happening right now?
I can speak about the second part.
Okay,
Yeah.
okay.
Yeah.
So the answer is that Medicare is still in existence. I think that there are policy changes that are coming into play that will decrease coverage, particularly for Medicaid and for the Obamacare marketplaces. I agree with you about the hoopla or the confusion, the anxiety, and I think that is honestly a call to action to all of us, where we can, especially I will say like navigators who work with people who have Medicare, Medicaid, that they are trusted sources. There's like the state health insurance assistance program, shiphelp.org, that you can find state, navigators who can help. There are Asian American organizations that help with healthcare questions, with immigration questions. I think a lot of those community organizations that are local are a good place for people to get information, and it's incumbent on all of us, I think, to be out there to talk about what is fact, what is fiction, and I will let you take the second part.
Besides canvassing, we have to look at how Trump got elected. He went on podcasts, he went on social media, and we cannot neglect that aspect. I mean, I have a podcast, I have social media, and I found that I have great power in that. So we have to understand that if we want to get elected, we have to go with where the youth are, because these are the people that are voting, college campuses, popular podcasts, social media, to get that Democratic vote, because it's coming to the fact that now I'm a public health person, the Democrats are all pro-public health and the Republicans have not. And so I'm very pro-Democrat. I can't be pro-Republican because they don't have any pro-public health policy. And so I'm elevating voices. I've had many politicians on my podcast. Annie Andrews is a phenomenal candidate running in South Carolina against Lindsey Graham. She was on my show. I'm having the Maxwell Frost coming on, who's the youngest congressman. So I'm using my platform, and I encourage anyone else who has access to that to start getting voices out there where people are listening besides the mainstream media.
So I want to make sure we're getting geographic balance in the room here. I see one over there. Can we do 4 more questions? 4 more questions? Okay. I'm getting some conflicting
Vin
guidance.
has a very tough job right now.
All right, right over there.
Hi, it's so nice to meet you all. My name is Shivani Parikh, and I represent tenants, but in New York City, but mostly I also advocate for South Asian blue-collar workers. We have a lot of folks who are taxi drivers, street vendors, domestic workers. The Black community, I think, has a really long-standing tradition of exposing medical racism when they become physicians. I was wondering, given that taxi drivers have high rates of diabetes, cardiovascular diseases, street vendors have respiratory diseases, hypertension from standing all day, inhaling pollution, I was curious to hear your thoughts about the future of our intra-community public health advocacy, given that we do have people from our background who are really struggling, and because the model minority myth, people don't know what's happening to them.
So it's a really important question, and I think, you know, what I have found in elected office is that data informs, but stories persuade. And so we need to bring the stories of those individuals into the political process. When I'm talking with colleagues who have no medical or scientific background, it doesn't help to put a peer-reviewed paper in front of them. It helps to bring a constituent who has a particular medical issue, who can articulate that to them and can then say, okay, now you understand the problem, here are potential solutions. So first of all, thank you for the work you're doing, but I think the power in the electoral process is bringing those individuals out of the shadows and into the light and telling those stories, whether through Mona's work or others, inside the political arena. That is very, very powerful, and that is the way that can be of impact in addressing these concerns.
Excellent, excellent. All right, I see one right there, and then we're going to go right over here, and then I know the secretary has to head out. For the other panelists, do you mind sticking around for folks that have questions? Okay, great. So over there, and then Tripati right over here.
Hey everyone, my name is Joya, and I'm a former federal worker who was impacted by everything. So I really loved my job as a comms director, but obviously in the health space, we were kind of pushed out. So I kind of wanted to ask you guys about taking the leap, you know, with being on social media and kind of doing roles that are not really always seen in our communities. Like, I would really love advice on how to take a leap now moving forward, because I want to see it more as an opportunity. And I think being South Asian sometimes, I'm also like, where do I fit into the space now? I was seen more as a whistleblower at my job with health things and saying that I wasn't going to post such things. So I'd really love to hear advice on like, how do I take that leap forward now and not change my last name Patel into something that's a little bit more plain?
I love that, and I think being on social media, I can answer to that. My last name's Amin, Mona Amin, so I go by Dr. Mona, not because I don't think people understand, but there's probably a little bit of insecurity of the last name. And I'm in a predominantly white field. Parenting is saturated with white women. And every time I succeed in something, I'm one of the top 20 parenting podcasts in the United States and the only woman of color. And so anytime, and I think it's important to say that because I share that on my stories and I explain, hey guys, look, I'm actually on here so that my followers start to see, oh, this is important to Dr. Mona. Like, this is something that she values because she's providing representation. I think if you have your why, which we talked about, if you have your voice and you have a list of 20 things that you want to talk about, you start creating those videos or those posts. And the goal of social media creation is not for the metrics. If you have any degree of anxiety or people pleasing, it's not the best place because it goes against everything that your brain is telling you that you shouldn't be doing, right? So you need to go into, I am posting because I'm changing the world. I'm not posting because 10,000 people like my post. I am posting because I'm making ripple effects that will eventually turn into a wave. And that's what I did when I was at 100,000 followers, not growing. I just kept posting because I wanted it and I loved the content and it grew. And it comes from authenticity, it comes from relatability, it comes from finding joy in the creation. So like if you are really passionate about some project or some advocacy piece, start creating the video. Do it for yourself and people will come because they're going to see how much you love what you talk about.
Wow, that's fantastic. Okay, I see, Tripathi, I think we have you as the last, and then unless I was told 5 minutes here, so maybe, okay, we have a little flex. All right, so I'm gonna put it right here for you. And then maybe one last one right behind. Yeah, we can do the
Good evening, ladies and gentlemen. Thank you so much for making time to be here for us. My name is Tripti Patel, she, her pronouns. I am the chairperson of ANC2A, which is where this conference is being held, so welcome. So as you know, DC is not a state. So I am one of the elected officials that is defending the district against the Trump administration. And so when you talk about like healthcare can be changed on the state level, what happens when you're not a state? Because right now I am trying to protect 700,000 residents who are in danger of losing a lot of their medical coverage benefits, like slashes to Medicaid, Medicare, DC Healthcare Alliance, which serves our immigrant population, is going to be slashed. I have people calling me every day, terrified and scared. Dr. Gupta mentioned he saw the National Guard. I represent the George Washington University campus. That is a red line. I can't have National Guard, armed soldiers on the campus with people's babies. And so what I want to know from each one of you is, number one, a request, I hope every one of you use your platform and say DC statehood now, because it is imperative for our survival that we are a state, because I am trying to defend every moment of every day. And my question to you as healthcare panelist is, how do I and my colleagues keep our mental health sane, and as well as our constituents? On my way here, I have constituents saying, I'm scared, what are you doing to protect me? That's it.
I'm gonna, in the interest of time, maybe, Mina, do you want to take that, and Arif?
Sure. So there are many parts to your question. I think number one, in terms of mental health, I will just say that I think it is so important to figure out what grounds you, what's your why, and how you can refill your cup, and that's different for everyone. I do a crazy 6 a.m. yoga class like 4 or 5 days a week, including 6:30 a.m. on Saturdays, so now you can really question my mental health. But there is a group of us who do this together, and that has been a saving grace for me in terms of community and, you know, just keeping my body moving, etc. Another point that you raised was around the change that has occurred between the interface of the federal government with local governments and with local communities. That has been incredibly disruptive. And I think that also, as we are navigating that, it presents an opportunity to think more broadly about our partnerships. So thinking about public-private partnerships, thinking about businesses and how businesses, it's in their interest to have a healthy workforce, and are there better opportunities for partnership there? So that's something that I know we in the state of Maryland are thinking about, because we also are dealing with, you know, federal funding challenges. I mean, not in the same way that DC is, but along a theme, how can we, in some ways, don't let a crisis go to waste, right? How can you look for opportunities to maybe do things differently, to diversify your sources of support so that you can emerge from this resilient?
So I can't analogize to Washington, D.C. I totally agree that you have taxation without representation, and we are seeing the consequences of that here. There's two things, one personal and one semi-professional that I will bring up. So on the personal level, the way I ground myself in this role as a state legislator, honestly, is I go out door knocking in my community, even when I'm not on the ballot. Like, my colleagues regularly say, you're always out door knocking. Why? And it's because I get to peak frustration in Harrisburg or in my office, and I'm like, I need to go ground myself about why I'm doing this again. It also helps in my community where we hear these fears, and being able to communicate, both acknowledging these fears and saying you're not alone in your feeling about this, and how we are going about in our role as a state legislator to try and make a difference is very, very important. So that's the first part. The second part is, what I found in politics is that you can build relationships based on shared interests, even if there are not shared values. And it's coming up right now in Pennsylvania. Pennsylvania, the largest industry is agriculture. You can imagine what's happening in the agricultural workforce because of the immigration crackdown that is happening out of this administration. I have colleagues across the country, or across the state, who are screaming bloody murder about this. And as an immigrant, I was born in India, it is something that we can have a conversation about and make a difference in terms of what state level policies we can make. So my two strong recommendations is keep up the grassroots activism and ensuring people that they're not alone. And second, look for those opportunities of shared interest, even if they may be diametrically opposed in political values and outlook.
Beautifully stated, both of you. All right, one last tight question, if we could, and then I think we'll have time for discussion after.
Thank you so much. My name's Mohammed Ali Sayed. I'm a business immigration attorney here in DC. I want to just express how amazing each one of you are, and thank you for being such solid champions of our community and just doing and sharing all these great stories and advice. One of my frustrations as an immigration lawyer in America, observing generally the discourse around immigration in popular media is that immigrants are taking away our jobs. It focuses around border security issues, and every day in my work I see immigrant entrepreneurs, immigrant professionals, doctors in underserved communities, hardworking people that are adding amazing value to this country. My question is, how can we, in our own little way, change that narrative? How can we take away the narrative that, immigrants are taking away our jobs? No, we are actually growing a much stronger America. So if you can speak to that a little bit.
Who wants to take that one?
So as an elected official, I like to speak, so I guess I'll go ahead and take that. I think, honestly, we have to continue to elevate that story with examples. What I said before about stories persuading, and frankly, as Indian health professionals, I think we're well positioned to do this. The stereotype of, your doctor's an Indian, but people value that. People understand the dedication that is involved. We need to elevate that story of examples in our lives. I talk about it in my very limited platform, and I think that we need to do more of that across the board. And I think we're seeing in the country now a real beginning of understanding of the importance of immigration and how detrimental the policies are out of this administration. But we have to keep pushing with those examples and stories.
Yeah, let me emphasize storytelling. There's a great book by David Brooks called The Second Mountain, and it really talks about, I think for us as a diaspora, we're getting to that second mountain. The first one was about community achievement, and that's largely, right? If I just reflect what my parents taught me to, that's what it was, right? Put your head down, work really hard, and make a lot of achievement. But I think right now where we are, and we have to own this as a community, is we're to that second mountain. The second mountain is creating joy for others. And that means paving the path telling the story, showing that we are part of a collective success, that there is not a scarcity mindset, which oftentimes affects us even competing against ourselves. Right? We have to get rid of that. That is where we are now as a community. And the moment we embrace not that for ourselves, and we create paths for ourselves to move forward and our children and others too, and we celebrate ourselves and we tell our story, we will become more successful. But I think it starts within this group, right? Because I can't convince other people that until we convince ourselves that the success of America involves the success of this room too.
Whew. Wow. Beautiful. That was, wow. What a way to cap this. Thank you. A round of applause here. What a group of leaders here. Thank you so much, guys. All right. Are we going to have a chance for folks to chat afterwards, or? Okay, great. Well, thanks, everybody. Thanks so much for your attention.
Thank you.
Folks, thanks again so much. And another round of applause for our amazing panel. Just want to make a quick note. We do have our breakout sessions. It says 1:30. We'll start at 1:40 promptly. So just a few minutes to head up there. But on the west end, on the second floor, that's this floor, we have Facing Civil Rights Together. In here, in this room, we have What I Wish You Knew, Bridging Generational Divides. And last one, I promise, then you can all head out, is also on this floor in the gallery is the Running for Office Campaign in a Box. Please look for Impact staff if you have any questions about where to go or anything like that. But thanks, everyone. Please go ahead and head out to a breakout session.